Hi, I'm making this video for my patients and anyone else who's interested because especially around this time of year, a lot of people are getting back into the gym and exercise programs without having done much exercise beforehand for a number of months. And I see a lot of people coming into the clinic with injuries that could have been prevented if certain predisposing factors were identified beforehand. So the purpose of this video is to just guide you through a quick movement screen that you can do on your own at home to check for some of the most common things that I see bringing people into the clinic with injuries. Okay, so let's get started. First of all, you're going to be reaching as high as you can overhead. And note, one, how high can you get, but especially how does it feel as you get up there? Are you having any pain or pinching, especially at the top of the shoulder as you get overhead? This is a really common thing I see called impingement. And what happens is the soft tissues are getting pinched between bones in the shoulder, and that over time, repetitively doing that, especially if you're lifting overhead, can start to cause some fraying and tearing and ultimately lead to a really big tear. And I promise you do not want to go through that rehab. It's a really long, painful process. Next, you're going to be looking at two motions of the back. First of all, keeping the knees straight. I want you to put your hands on the backs of your hips and let your hips glide forward as you extend backwards. If you have to immediately bend your knees because you don't have much extension in the back, that's a problem. Overall back health is very linked to our ability to extend. And if you have any pain while you're doing that, or if you're really stiff in doing it, it's something that can lead to a number of issues and it needs to be addressed. Next, I want you to go in the opposite direction, just leaning forward as far as you can, let the low back round out. First of all, if you can only get to here because you're so tight in the hamstrings or back, that needs to be fixed. But secondly, if you're getting low but you still have a really sharp pain or pull, or especially any pain down the leg, you're really asking for trouble if you're going to jump back into the gym before you get that addressed. Next, I want you to go through some squatting motions. You'll probably need to do this in front of a full-length mirror. So keeping your heels on the ground, just squat as deeply as you can, right? And come back up. Note a few things. First of all, are you having any pain in the knees or anywhere else as you do that? If you're going to be in an exercise scenario where you're doing a lot of squatting motions and something's hurting a little bit now, that can become very painful later. Or you could be doing things to stay off of that side or away from that pain that cause you to overload something else and leads to injury that way. So if you have any pain, it's something to deal with. Then look at your knees. Are your knees able to go directly over your toes, or are they dropping inward for some reason? Do you have to put your feet out for them to stay going straight? That can be an issue at the ankle, which we'll look more at here in a second, or it could be a hip issue, something going on with the hip muscles. More specifically, looking at that, now you're going to do a one-legged squat. And again, putting the other leg out, can you keep that knee directly over your toes? If not, if it's falling in like that, you probably have some hip weakness. And what happens is that puts a lot of strain to the medial side of the knee, and there's a lot of things that can come from that, including major ligamentous injury. Okay, so make sure that you can do a mini squat with the knee directly over the toes with a good stabilizing hip musculature. Okay, and finally, we're going to look a little closer at the ankle range of motion. So now with each leg, what you're going to be doing is looking at how well the ankle moves when you're driving your knee forward. So we're looking at just the front leg here, okay? You're going to keep your heel down and see how far your knee can go straight over your foot. Now, there's a few things you're looking at. One, how far can you go? If you can only go to here and you can't go further, that's not much range of motion, okay? And that's really going to change the way you squat and the way your ankle moves when you run. The other thing I'm going to show you from the front, as you do this, don't let the knee drop inward like that. I want it straight over your middle toe. The last thing you're looking at is not just range of motion, but what stops you from going further. When you get to here, when you get to the end range, it should feel like there's some kind of a stretch through here. And it may be easier if you're holding onto the wall or something with your hands so you don't have to support yourself with your legs so much. But just driving your knee over, do you get stopped by a stretch back here, or is it a binding somewhere or a pinching feeling somewhere in the front of the ankle? That's a problem. Or if you have any sharp pains on the lateral or medial side of the ankle, that stop you from going further. Those are all things that are going to keep your ankle from moving the way it should as you exercise. So that was a quick way to identify if you have some of the most common predisposing factors to injury that I see in my clinic. If you're a patient of mine and you found any of those issues, please let me know. They're all very treatable. We can knock them out before they lead to any major injury. If you're not a patient of mine, or you found this video online and you're not in the Austin area, certainly find a physical therapist who you trust, who has good reviews or that you've used before, and let them know what you found so that you can knock those things out before they become a problem.